Welcome to the Psychology and Physical Training channel, Developmental Disorders. Have you ever wondered why some children behave differently than others? Could it be a sign of a developmental disorder? Today we plunge into the captivating world of developmental disorders. These conditions, often misunderstood, can greatly impact the lives of individuals and ripple through society. Knowledge is power, and understanding these disorders is the first step in fostering a more empathetic and inclusive world. In this video, we will explore some of these disorders, their symptoms, causes, and ways to manage them. Understanding autism. First on our list is autism, but what exactly is it? Autism, more formally known as autism spectrum disorder or ASD, is a developmental disorder that affects an individual's ability to communicate and interact with others. It's like being in a play where everyone else has the script, but you don't. You're constantly trying to figure out your lines, trying to interpret the cues, and often feeling misunderstood. One of the most common symptoms of autism is difficulty with social interaction. This can range from difficulty making eye contact and understanding social cues, to struggling with maintaining conversations or forming relationships. It's not that individuals with autism don't want to connect with others. It's just that they might need to do it in their own unique way. Communication issues often go hand in hand with these social interaction difficulties. Some individuals with autism might not speak at all, while others might have extensive vocabularies, but struggle to use language in a socially appropriate way. Repetitive behaviors are another common symptom. These can include things like repeatedly lining up toys, flipping light switches on and off, or obsessively following certain routines. While these behaviors might seem odd to some, for individuals with autism, they can provide a sense of order and predictability in a world that often feels overwhelming. But here's the important thing to remember. Autism is a spectrum disorder. This means that the severity and combination of symptoms can vary widely from person to person. Some people may have mild symptoms and be able to live independently, while others may have more severe symptoms and require more support. So when we talk about autism, we're not talking about a one-size-fits-all diagnosis. It's a broad range of conditions characterized by challenges with social skills, repetitive behaviors, speech and nonverbal communication. Autism can be challenging, but with understanding and support, individuals with autism can lead fulfilling lives. Remember, everyone's experience with autism is unique, just like their fingerprints. That's what makes understanding autism so crucial. It's not just about understanding a disorder, it's about understanding unique individuals who see the world in their own special way. Causes and symptoms. Next, we delve into another disorder, commonly known as mental retardation. This is a term used to describe a group of conditions characterized by significant limitations in both intellectual functioning and adaptive behavior. This term, however, is increasingly replaced with the more respectful term, intellectual disability. Intellectual functioning, also known as IQ, refers to a person's ability to learn, reason, and problem solve. Adaptive behavior, on the other hand, includes practical skills such as self-care and social skills. Now, what could cause such a condition? Causes of intellectual disability can be diverse. They can be genetic, such as Down syndrome and Fragile X syndrome. They can also be environmental, including factors like alcohol or drug use during pregnancy, malnutrition, and exposure to harmful substances. Complications during childbirth, such as oxygen deprivation, can also lead to this condition. But how do we recognize it? The symptoms of intellectual disability may appear at birth or later in childhood. Often the most obvious symptom is a significant delay in reaching developmental milestones. For instance, a child might learn to walk or talk later than their peers. They may also struggle with memory, problem-solving, and logical thinking. Adaptive behavior is another area affected by this disorder. Individuals may find it challenging to master basic life skills such as self-care, socializing, and communicating effectively. They might also struggle with understanding and following social rules and customs. Remember, it's vital not to jump to conclusions based on a single symptom. A comprehensive evaluation by a team of professionals is necessary to diagnose an intellectual disability accurately. Mental retardation is a lifelong condition, but with appropriate support, individuals can lead productive lives. Let's remember that every individual, regardless of their intellectual capabilities, deserves respect, understanding, and the opportunity to reach their full potential. Recognition and treatment of psychological problems. Recognizing and treating psychological problems is crucial for managing any developmental disorder. This statement underpins the core of our discussion today. Early detection of symptoms and seeking professional help can significantly affect the trajectory of these disorders. One of the first steps in managing psychological problems is understanding the signs. Symptoms can range from difficulty in social interaction to severe mood swings, and even to an inability to perform daily tasks. These signs often manifest subtly, and it takes a keen eye to spot them. However, remember that these symptoms don't define the person. They are merely indicators of an underlying issue that needs addressing. Once these signs are recognized, the next step is seeking professional help. Psychologists, psychiatrists, and therapists are trained to diagnose and manage these disorders. They use various techniques from observation to structured assessments to identify the specific problems at hand accurately. This process may seem daunting, but it's an essential part of ensuring the individual gets the right care. Now, let's delve into the treatment options available. There are 3 primary ways to approach treatment: therapy, medication, and holistic approaches. Therapy, particularly cognitive behavioral therapy, has shown to be highly effective in managing many psychological problems. This kind of therapy helps individuals develop coping strategies and change unhelpful patterns of thinking. Medication, on the other hand, is often used in conjunction with therapy. It can help manage symptoms and make therapy more effective. However, it's important to remember that medication isn't a cure-all. It should always be used under the guidance of a medical professional. Lastly, holistic approaches can also play a significant role in treatment. This can involve lifestyle changes such as a healthy diet, regular exercise, and adequate sleep. These changes can help improve overall well-being and supplement other treatments. It's essential to remember that treatment is not a one-size-fits-all process. What works for one person may not work for another. The key is to find what works best for the individual and their specific circumstances. This journey may involve trial and error, patience, and resilience. Also, the support of family and friends is invaluable in this process. Their understanding, patience, and love can provide a much-needed boost for anyone going through treatment. Treating psychological problems is a process, but with the right approach, progress can indeed be made. And with every step forward, no matter how small, we move closer to a world where everyone, regardless of their psychological challenges, can lead fulfilling lives. Dealing with mentally challenged individuals. Interacting with mentally challenged individuals might seem daunting, but it needn't be. The first step towards meaningful interaction starts with understanding. Understanding that they perceive the world differently from you and me, and that's okay. It's our responsibility to reach out and connect, to find common ground. Now, how do we do that? Well, effective communication is the key. When communicating with individuals with developmental disorders, remember to keep your language simple and clear. Avoid abstract concepts or complex terminologies. Instead, use concrete examples and familiar words that they can easily grasp. Patience is another crucial element. Understand that they might take longer to process information or respond to your questions. So give them ample time. Don't rush. If they're struggling to express themselves, stay calm and reassure them that it's okay to take their time. It's also important to pay attention to non-verbal cues. Many individuals with developmental disorders communicate more through their actions, gestures, and facial expressions than words. So learn to read their body language and respond accordingly. And let's not forget about empathy. Empathy is about stepping into their shoes, trying to see the world from their perspective. It's about validating their feelings and experiences, even if they're different from ours. Show them that you genuinely care and are there to support them. Lastly, respect their boundaries. Just like anyone else, individuals with developmental disorders have their comfort zones and personal space. Respect that. Never force them to do something they're uncomfortable with. In conclusion, effective communication with individuals with developmental disorders involves a blend of understanding, patience, clear language, nonverbal cues, reading, empathy, and respect for personal boundaries. It's not always an easy task, but it's certainly a rewarding one. Remember, each person with a developmental disorder is unique, and with empathy and understanding, you can make a positive difference in their lives. Conclusion. So, what can we take away from this discussion on developmental disorders? Throughout this journey, we've shed light on the complexities of developmental disorders, focusing on autism and mental retardation. We've grappled with the symptoms, causes, and the unique challenges they present. From the silent world of autism, we've learned that it's not a limitation, but a different perspective of life. We've explored the symptoms and understood that early diagnosis can lead to better management and improved quality of life. In the realm of mental retardation, we've unpacked the causes and symptoms, emphasizing the importance of early detection and intervention. We've also navigated the path of recognizing and treating psychological problems, highlighting the necessity for empathy, patience, and tailored therapeutic approaches. Our journey ended with the vital topic of dealing with individuals who are mentally challenged, reminding us all of the importance of understanding, inclusion, and support. Remember, knowledge is power. The more we understand about developmental disorders, the better equipped we are to support those affected by them. And if you like this video, do not forget to subscribe to the Psychology and Physical Training channel for more videos. Thanks for watching.